Emergent Literacy Intervention for Vulnerable Preschoolers, Relative Effects of Two Approaches. Originally written by Justice, Chow, Capellini, Flanagan, and Colton, and published in the American Journal of Speech Language Pathology in 2003. Reviewed by Caroline Miller, Lindy Morgan, and Bethany Yoder. Emergent literacy refers to the foundation upon which children's conventional reading and writing abilities are built. The foundation is acquired within the period preceding formal literacy instruction, transcending birth to about 6 years. The purpose of this study was to determine the efficacy of two separate approaches in emergent literacy. The authors looked at children who are at risk for reading disorder, that is, those who are living in poverty, and those with an oral language impairment. Separate aims that the authors looked at was to determine the extent emergent literacy intervention affected literacy skills in children who are at risk, to characterize the efficacy of an experimental intervention program, and to identify characteristics that best predict emergent literacy outcome after intervention. The participants that the authors used were children from an urban, predominantly African American preschool. The children who participated were 4 years of age with a mean age of 53 months or 4 years, 5 months. Prior to the actual procedures, children were given a hearing screening, the Goldman-Fristow test of articulation, and the preschool language scales, 3rd edition. Participants were considered language impaired if they made a standard score of 81 or lower on the PLS-3. All participants completed a 12-week intervention program targeting emergent literacy. Children were given 2 waves of intervention. Each wave lasted 6 weeks with 12 sessions for 30 minutes. Group A was given the explicit intervention program for 6 weeks first, and Group B was given the comparison program for 6 weeks. The groups were then switched after 6 weeks with a 1-week interim.
The explicit intervention program used orthographic features and phonological features. It targeted 3 components in each session: name writing, alphabet reciting, phonological awareness. The comparison intervention program used implicit focus on oral and written language. It targeted 2 components in each session: shared book reading with adult and child, and story retelling. The children's literacy knowledge was checked 3 times. Pre-test before the 12-week program started, interim during the week between the 2 6-week programs, post-test after 12-week program concluded. 5 measures were used to assess emergent literacy knowledge. Alphabet knowledge, assessed using the alphabet knowledge subtest of phonological awareness literacy screening pre-kindergarten. Print awareness, assessed using modified version of concepts about print test. This was modified to make it more appropriate for the children's ages. Name writing, assessed using writing subtest of the PALS pre-K. Phonological segmentation, assessed using the segmentation subtest of phonological awareness test. Rhyme production, assessed using the rhyme production items of the rhyming subtest of the PAT. Results for AIM 1. AIM 1 was to determine the extent emergent literacy intervention affected literacy skills in children who were at risk. Results were visual inspection of these data suggests growth over time for all areas examined. The findings indicate that children made substantial gains in collective consideration of the emergent literacy measures over the 12-week intervention period. Results for AIM 2. AIM 2 was to characterize the efficacy of an experimental intervention program. The explicit intervention program results indicate that all 5 levels that were measured made significant gains. For the comparison program, the children only showed significant growth on phonological segmentation.
Results for AIM 3. Aim 3 was to identify characteristics that best predict emergent literacy outcomes after intervention. The researchers explored 4 different possibilities for predictors of emergent literacy. These were literacy orientation, oral language, speech production, and behavior. In terms of individual predictors, only oral language and literacy orientation contributed significantly to the prediction of literacy outcomes. The researchers concluded by finding evidence to support that there is substantial emergent literacy growth in certain intervention programs. They also found evidence to support that the explicit intervention program was more beneficial for the children and created more growth than the comparison intervention. Specifically, it created greater change across language modalities. General impressions of the study. The importance of emergent literacy was targeted in this article. Many different language skills that would form a foundation for appropriate literacy growth were the focus of the intervention programs. However, using explicit treatment methods were more effective for children at risk than shared book reading and storytelling alone. The research design implemented was useful because the sample size was small. However, if the sample size were to be increased, a different design should be implemented. The researchers could improve their study by having a between groups design and a larger sample size in order to generalize to different populations. This is applicable because phonological awareness is a predictor of future literacy difficulties. Emergent literacy is a foundation for literacy, so implementing programs that focus on this could help reduce future literacy difficulties. In our practice, we could help facilitate emergent literacy by using pictures and words to create an association between objects and written language.